You know, Redfern has a very good and a vibrant community, but it's not just a community here of Redfern. We go all over New South Wales, and in actual fact, when there are national conferences on or national sports events or whatever, people come here and they always make their way to check out the medical service. So it's a community of Australia-wide, I suppose. It's the Indigenous community of this country. If people in Redfern are not well, then Aboriginal people right throughout Australia are not well. And if people aren't well in Perth or in Townsville or Hobart, then we're not well. So Aboriginal people have got to start looking after and seeing ourselves as the total community of Indigenous Australia. Each medical services, over 200 I believe at the moment, interact with each other so we all know how and what each other are doing. The board of an Aboriginal organisation, and that's any, but in particular health, because there's so much pressure on being on a board of an Aboriginal health service. You're competing against hospitals, you're competing against Medicare locals, you're competing against all the other Aboriginal health dollars as an Aboriginal medical service. So you come under that microscope. One of the biggest challenges is being there and having a look about your priorities here. Now, ministers, state and federal, might have a priority about this and that, and they'll put the dollars for this and that. But I mean, in actual fact, the priority that the board sets has got to be one that takes into account the local health needs and the local health issues. That's what self-determination is all about, and that's what we're all on about, self-determination, and of course, with that comes all the other issues. But you've got to know what you're tackling, what the priority is. Sometimes a minister, state or federal, health minister, they have their flavour of the month. So diabetes might be the flavour of the month. So every medical service then is expected to go out and do this, that and the other in diabetes. Drugs might become a big issue, when in actual fact for us it'd be alcohol. So you've just got to manage and massage those sort of situations where you say, here's the priority and here's what we be looking at fixing. And that way then, that's what community control and self-determination is all about. When we first started hiring doctors here in Redfern, we used to take them down, all the applicants that we were going to interview, we would take them around Redfern and take them to the riverbanks and show them this and that and the other. And we used to say to them, this is where your patients are coming from. So the doctors themselves had an idea exactly what they were treating. It wasn't just somebody coming in here with a cut foot or, a bandaged arm or something like that. It was somebody that came from a house that was overcrowded. It was somebody that come from a house where violence was there involved, So they knew exactly what to expect. And I think that's why we had a lot of doctors that were here for quite some time. And see, the other thing is that it's the staff. And a lot of our staff are Aboriginal. And some of them, it's the first job and only job they've ever had after leaving school. And some have been here for 36 years, some for 30 years and all that. It's the one and only job they've had. So people get to know, the patients and clients get to know who that person is. And the other thing is, see, we had no Aboriginal doctors when Redfern first started. And I think there's something like now 165, 170 Aboriginal doctors throughout Australia. I mean, it's a great thing. Not all of it, of course, is because of Aboriginal Medical Services, but I think a lot of it is. A lot of Aboriginal people continue to come back and use Aboriginal Medical Services, not just here, but I think all over, because they get to know the staff, they get to know the doctors, and they just get to know, if you come here with a cut foot, then yes, they'll look at the cut foot, but health workers will also ask, would you like this check? Would you like a blood check? Would you like this and that and the other? Is there anything else bothering you? So you have a holistic approach to that person, not just the individual in their cut, but indeed the whole community. So if that person's got, it's come from a household that may have something going on there, then you can go and treat that whole household.